Welcome back to Scissors and Scrubs. It's been quite a while.
Yes.
I'm Nicole.
I'm Laura.
Deep apologies to everybody. We haven't been behind the microphone in a little bit. A lot of shit's been going around. We got stuff to do. We've been busy little ladies. Busy little ladies. So it kind of got away from us, and then all of a sudden we're like, oh, we have to record, and it's like Easter week.
Yeah, that's not happening.
There was no way that was happening, and then we're heading off to California, and so yeah, it's been wild.
Yeah.
So we're coming back with a really happy, joyous,
real
lovely topic.
Real up.
Birth defects.
Yes.
Because, why not, right?
Why not?
I don't know. Hopefully this isn't coming out on Mother's Day because that would be terrible.
No, it's coming out. This is still April.
All right. So we're going to cover a couple of we're going to cover birth defects that can happen in utero.
Pregnancy complications in the baby.
Pregnancy complications.
In the baby, maybe.
Yeah, I think that makes more sense.
Yeah. So we came to this topic because my son is having a baby, and they got an ultrasound, and it was a scary topic, and the baby had fluid in her lung, and they kind of prepared them for the worst. And then they got another, ultrasound with somebody, like a high risk person, and they're like, okay, well, it's a little bit better, and blah, blah, blah. And they keep doing ultrasounds, and we've been crazy.
It's been an emotional roller coaster.
It's been wild.
And rosaries have been blown up.
Praying nonstop.
Priests have been consulted.
Yeah. And the last one they had, there was zero fluid seen. So it's good, and she should be fine, and everything should be good.
And now we have to rename this baby Pasquina because she's an Easter miracle. Yes.
So one of the things that they were afraid she had is called hydrops fatalis. And so that's why we did this.
That's why we're doing in utero complications.
Yeah. So I'm doing hydrops fatalis. And it is a rare, life-threatening condition that occurs when a fetus or newborn has severe edema or swelling. They also have excessive amounts of fluid build up in at least 2 body areas. So if they had like a lot of fluid in one area, it's not really hydrops fatalis. But if it's 2 separate areas, then it is. It can lead to stillbirth, preterm labor and delivery, illness of the mother, and severe illness or death of the newborn.
Oof.
The treatment and prognosis of the condition vary depending on the health issue causing the problem. Sometimes the underlying problem can be treated, and sometimes it cannot. It can be 2 different types. It can be immune or non-immune, and the cause of the fluid buildup determines the type. Immune hydrops fatalis occurs when your red blood cells are incompatible with the fetus's red blood cells. This
if you're Rh negative in the okay. That's why I had to get the butt shot.
Yeah, it destroys the fetus's red blood cells, leading to problems like total body swelling, and the resulting severe anemia leads to heart failure. Non-immune hydrops fatalis is more common. It accounts for 9 out of every 10 cases, and this type occurs when an underlying medical condition or disease affects the fetus's ability to manage the fluid. Hydrops fatalis, like I said, is a rare life-threatening condition. Your healthcare provider may be able to see signs or symptoms of hydrops on an ultrasound during your pregnancies. These symptoms include excessive amount of amniotic fluid, thickened placenta, a large fluid-filled sac around the fetus's neck, buildup of fluid around the heart, buildup of fluid around the lungs, buildup of fluid in the abdomen, buildup of fluid in the skin and soft tissues, and an enlarged heart, liver, or spleen. In addition, you could have the mother could have preeclampsia, high levels of protein in the urine, and the mother can also have total body swelling. After the baby's born, the symptoms may include changes in skin color, difficulty breathing, bruising or pinpoint hemorrhages due to a low platelet count and thrombocytopenia, heart failure, anemia, jaundice, and total body swelling. The cause depends on the reason for the fluid buildup. Immune hydrops fatalis usually occurs, like I said, due to the blood incompatibility. If you have different Rh factors, like if you're Rh negative and the fetus is Rh positive, you'll make antibodies against the fetus's red blood cells. And that also, this leads to the total body swelling. You can prevent this type of high drops by getting a RhoGAM shot. It's a medicine that stops your immune system from making the antibodies.
Right in your butt right after delivery.
One of your kids is negative? Oh, you're negative.
I'm negative.
Rh compatibility is the most well-known cause, but other less than common causes of the immune high drops include an immune system reaction to other red blood cell antigens like Kel, Duffy, and Kid antigens. So you can have another reaction against other antigens. The non-immune high drops fatalis occurs when the fetus has underlying disease, a birth defect, or a genetic disorder that affects its ability to manage fluid. These include heart conditions, chromosomal disorders, metabolic diseases, tumors, urinary issues, blood-related issues, red blood cell disorders, and diseases and infections in the mother. High drops can lead to spontaneous miscarriage, preterm delivery, and early death of the newborn. In babies that survive, other complications may occur, including developmental delays, chronic lung damage, and liver damage. Like I said, it's usually detected on prenatal ultrasound. They'll see abnormal amounts of fluid in the fetus's heart, lungs, belly, skin, and soft tissues. And again, you have to have 2 areas of buildup to define the non-immune high drops: an enlarged placenta and high amounts of amniotic fluid. If your provider detects high drops, they may refer you to a high-risk OB or maternal fetal medicine specialist. They'll work to really quickly try to determine the underlying cause. Finding out the cause is important because you can treat them if they're treatable causes. They can also do amniocentesis, fetal blood sampling, fetal echocardiogram, genetic testing, fetal MRI, and blood tests including mean corpuscular volume, or MCV, and testing for viral infections.
I wonder if that had anything to do with the 2 miscarriages I had between Cameron and Vienna. Make sure.
Oh, because you're negative, yeah. Despite these tests, healthcare providers can't figure out a clear cause of high drops fatalis in about half of all cases. So it just happens and they don't know why. They'll work really closely with you and try to, treat the baby, and let you know what to expect during and after pregnancy. Treatment depends on the various factors, including the cause of the condition and the severity of condition and the age of the developing fetus. Treatment is not always possible during pregnancy, but when it is, it can include a fetal blood transfusion. The fetus receives an injection of red blood cells through the umbilical cord to treat anemia.
That'd be rough.
Antiarrhythmic drugs, because when the fetus has an irregular heartbeat, you may receive drugs that pass through the placenta to treat the baby's heart.
Poor mother having to go through this. This would be brutal.
You can have a shunt placement. If the fetus has fluid around the lungs, a surgeon may place a shunt to drain the excess fluid. And if the fetus has a teratoma, a surgeon may be able to remove it or use surgery to treat other prenatal problems on the fetus itself. And then treatment for a newborn with high drops may include a C-section. And they'll be delivered through C-section and receive immediate specialized care in the NICU. Ventilator, the baby may need extra oxygen or a machine to do the breathing for them if they have difficulty breathing because of the fluid. They might do fluid removal, like take the extra fluid out from around their lungs and bellies after they're born, and a blood transfusion if they have immune high drops fatalis. They're gonna, if they suspect it or you're diagnosed as you are closely monitored through the rest of your pregnancy. They're doing tons of ultrasounds. They're checking your health, the baby's health, the level of the fluid. You're closely monitored. You might see a maternal fetal specialist, a pediatric cardiologist, a neonatologist, a geneticist, and a nurse specialist care coordinator. One thing your providers will be watching for in this condition is called maternal mirror syndrome. It's a type of preeclampsia in which you mirror your fetus. So you develop excess fluid around your body.
Weird, huh?
And you may have like other symptoms too. And if you develop this condition, you'll have to deliver your baby early for, the mother and the baby's safety.
You'll both get lost.
Yeah. Outlook and prognosis. The outlook for fetuses and babies born with hydrops varies widely depending on the several factors, including the underlying cause, the age of the development feeding at diagnosis, the amount of swelling in the fetus, prenatal treatments, the age of the fetus at delivery, and the extent of treatment necessary at delivery. The overall survival rate is less than 50%. The development of severe hydrops before the third trimester of pregnancy carries a high mortality. Prognosis is better for treatable causes of hydrops, like fetal arrhythmia, like if the baby's heart just has an arrhythmia, if you can give them the drugs, it has a better outcome. The poor for causes like they have severe birth defects. And if they're born, extremely early, whatever. You can prevent immune hydrops fetalis by getting a ROGAM shot during and after your pregnancy. Again, it helps your body from producing antibodies against the baby's red blood cells. You'll only receive that if you're at risk for Rh incompatibility. But you cannot prevent the non-immune hydrops fetalis. And that is hydrops fetalis. And I got that from Cleveland Clinic.
Joyous statement. And before I go on to my lovely, I need a drink. Hold on a second.
So,
okay, I'm back. I have to buffer up for this. I'm going to say this. It really is a miracle of life when you have a healthy, beautiful baby, even though some people then have one and throw it in the trash. Because so many things can happen during development of a fetus that to have a kid come out all 10 toes, all 10 fingers, 10 toes, normal heart, it really is a miracle that it happens. So on that note, we're going to talk about anencephaly. In medical terminology, anything with an an usually means there's nothing.
Right.
It's done. Nothing. So anencephaly, which is a birth defect, it's a congenital disorder, is where the baby is born without parts of their brain or their skull. And when I say without parts of their skull, like above the eyes is flat. There is literally no cranium at all. It affects the baby's nervous system, the brain, spine, and nerves, and it happens when the neural tube, which is what develops the brain, the skull, the backbones, and the spinal cord, it doesn't develop or it fails to close as it should in the first months of pregnancy. Like spina bifida, that happens. These are part of those neural tube defects. That is why anencephaly is a type of cephalic discord called the neural tube defect. The brain is essential to survival, obviously. It controls body functions, emotions, and memory. Since anencephaly affects how the brain develops, babies born with it usually live only a few minutes, hours, or days. Most pregnancies with this will end in miscarriage or stillbirth. And if you have actually delivered the child, many of them will die within hours or days of having the baby. So there are 3 types. God bless if I can get these through, because meroanencephaly, that's where the brainstem and the midbrain are only partially developed. Some skin and skull cover the brain. Holoanencephaly, which is the brain doesn't develop at all, and it is the most common type. Craniorachisis, that's where the brain and skull and spine don't develop at all, and it is the most severe type. What would cause, or what are the signs and symptoms of anencephaly? There are high levels of alpha-fetoprotein, which is a fetal protein from a blood test or a sample of amniotic fluid from the mother. This can be done in the second trimester of the pregnancy. Polyhydramnios, which is too much fluid in the amniotic sac, which they might see on an ultrasound. Or they can also tell in the ultrasound that it's missing parts of the skull and the brain. There might be exposed areas of brain tissue, no skin or skull covering it, and a smaller head size than expected. And with the ultrasounds they have today, you could tell everything with these kids. So you're going to, unfortunately, really see this graphically displayed. So the birth mother may not be aware of any symptoms until a blood test or an ultrasound is done. Newborns with anencephaly, so if you are to actually deliver this child, they do not have any awareness, any consciousness, no vision, no hearing, and they do not have the ability to feel pain. Not all newborns with anencephaly develop brainstem. If they do, they may have reflexes and automatically respond to touch. And seeing a newborn respond like this might give you hope that this kid's going to be something. But it isn't a sign that they're aware of your touch or that they'll be able to live long-term with this condition. It's just an automatic reflex from the brainstem. So we've already discussed it is caused because of neural tube defects. Like I said, the brain and skull, it's the top of the neural tube didn't develop. The spinal cord, it's the middle of the neural tube didn't develop. And the backbone's the bottom of the neural tube didn't develop. Because the way a fetus develops is so bizarre.
I know.
It's really bizarre. It's cool, but very, very strange. So anencephaly happens when the top part of the neural tube doesn't close during embryonic development. It occurs during the 3rd or 4th week of pregnancy, and the fetus continues to form except the front of the brain and the top of the brain do not grow. Other parts of the brain may develop as expected, but no skin or skull will cover them, which is really bizarre. It's not inherited, but in most cases, it will occur without any family history of the condition. It's a sporadic genetic mutation. If you've had a child with a neural tube defect before, like spina bifida, you do have a higher chance of having a baby with anencephaly. I remember when I was younger, the big push for women to take folic acid.
Yeah.
And this is why you were taking folic acid before you even try getting pregnant, because it's huge in the development of the neural tube. So the risk is about 2 to 3% higher, which is actually 20 times higher in somebody who has not had a baby with spina bifida or a previous tube. It can occur if you've had high temps during pregnancy when the neural tube is developing. Like you should stay out of saunas, hot tubs, or if you yourself had a high fever, that could be a problem. People with diabetes can sometimes develop it. People with severe obesity could sometimes develop a child with this. Other risk factors are lack of folic acid, which is not getting enough folic acid and vitamin B9 when you're pregnant puts you at a higher risk of having a baby. So that's why they suggest you take prenatal vitamins with 400 micrograms of folic acid before and during pregnancy. As I mentioned, diabetes changes to the blood sugar levels in your body. So if you're not managed diabetic and that your blood sugars are up and down, it's very dangerous for developing fetus. Medications, anti-seizure medications like phenytoin, carbamazepine, valproic acid, Depakote, that can have problems with neural tube disorders. Some of the medications used to treat migraines and bipolar disorder can also have a problem. Opioids. So if you were taking hydrocodone, oxys, morphine, methadone, tramadol, fentanyl, codeine, or hydrocodone, huge risk for a child with these things. So how is it diagnosed? They're going to do a quad screen marker, and it's blood tests that check for neural tube defects and other genetic conditions. They will take blood, they will send it to the lab. One of the tests is the quad mark screen, and it's checking for the alpha fetoprotein. The AFP test, it detects higher levels of the protein. The fetal liver makes the AFP, and it will leak into your blood if anencephaly is present. Ultrasounds will do it. Fetal MRIs, they check in to see what's going on in there, and an amniocentesis, that's a risk of a miscarriage. Right. So you're really only going to do that if you really think there's a problem. They put a thin needle into the amniotic sac, and they will take a fluid-filled bubble from around the fetus and your uterus, and they would draw some fluid. That's what, I'm sorry, it's explaining what the amniotic sac is, but I'm assuming most of us are nurses, so we all know what that is. And they do and they're looking, again, for high levels of the AFP. How early can it be detected? It can be detected after 8 to 12 weeks in the first trimester. It usually happens they usually will screen if they suspect it 18 to 20 weeks. The way it is treated, there's no cure for anencephaly. You can't fix this, and almost all babies born with it will die within a few hours or days after birth. So they're going to give you options on how to deliver the baby and how to grieve the baby. And most hospitals these days, after a certain week, they're going to do like kits where they will take little handprints, and it's so hard to watch it, but I think for the grieving parent, if there's hair, they'll cut little hair for the baby, and they do a little feet print, and it's very sweet, and they'll put little medical, like all the little keepsakes,
it's like a little memory box,
box for that baby. What is the outlook for it? It's a fatal condition with a poor outlook. Most fetuses with it pass away before birth, and again, these babies aren't going to make it. but they don't feel pain. So if you're worried that your newborn would be distressed, uncomfortable, or in pain, they cannot feel pain. Infants who survive birth seem to respond to touch or sound, but they aren't really responding to feeling a sound because they don't have the largest part of their brain, which is the cerebrum, which allows them to move, think, feel, and respond. I can be prevented by getting plenty of folic acid. If you are going to take medications or change medications, talk to your healthcare provider before like there are pregnancies that are unplanned. It happens. But if you think you're unprotected sex, whatever, take your vitamins.
Yeah.
Just, eat some, I forgot what folic acid is in, green leafy vegetables or something. Just eat your good stuff.
Carrots? What is that?
Manage your health. And that, unfortunately, is anencephaly. Very joyous.
Yeah.
Very, very joyous. I need another drink.
My first nephew had, Ryan, had semilobar holoprosencephaly.
It's so easy to pronounce.
I know.
I have a brain and I can't
which
pronounce
is a type of anencephaly. And my sister had him. I think I want to say we went to the anatomy scan, and me and my mother went with her because she was so excited. Oh, come to the scan. And they saw it on the scan. And
that's tough.
Right, it was awful. And then she delivered him early, and we held him, and he was like this little. He was adorable. He was perfect. His head was completely intact. That's not the kind he had a different kind. But
there is a kind where the lobes of the brain don't separate.
Yes, that's what he had.
And that also does not work.
Yeah. But he, he was just this little perfect little thing, but his head looked completely perfect. But inside it was,
they
not,
had a picture of some kid with anencephaly, and it's freakish.
Yeah, the ones with the tops
with
of the
it's
heads.
literally
that's hard to look
at. If you know anatomy, you can tell it's just the base of the skull.
Yeah.
It was tough, and I just can't imagine a poor mom being all excited about their baby and
I know.
having to deal with this. I think it's terrible. I fortunately had 3 relatively normal children.
Normal enough.
They might be a little brain damaged, but they are good kids, and they came out with all the stuff they're supposed to come out with. But it's terrible.
It is. They did the little memory box for him, and his little footprint looks like a little. I don't even know, like a little. I don't know how, like a little fairy's footprint. Like a little. It was like so.
We've done
tiny.
We've done a memory box, but I did it on an 18-year-old, and that was tough. That was very, very difficult.
Yeah.
I don't want to do another one of those again. So we're going to cheer up the episode a little bit with some emails. Okay. We've been a little lacking on our emails. We've had a few come in. I don't have my phone with me, so I have to read it off of yours if you don't mind. We got 3 different ones, and Laura and I are going to share her phone and read these emails because my phone's DED.
All right, there's the first one.
Oh, excuse me. I don't even know where that just came from. Okay. No subject. Hi, Laura and Nicole. Was wondering if you guys did an episode on Fournier's gangrene. That shit you can smell down the hall.
I feel like we've definitely talked about it.
I know we've talked about it.
Because I know you've complained about me putting you in cases.
5 of them in a row, I believe you gave me a Fournier's.
Regardless, I feel like we've talked about it. 2
little eyeballs when they're done with the scrotum. She's in the South. And now that it's getting warmer, my list of patients with this issue is going to go up. Yes, it is. Maybe a PSA to everyone to keep clean and dry down there.
Yeah.
Don't share razors and watch your blood sugar. And also another fun one, not for the patients, is Hydradentist Suprativa. I have never heard of that. Thanks for your awesome podcast. I never miss an episode, Katie.
Well, maybe we'll do that for Father's Day.
What Fournier's?
And the other one. I think the other one is
another bald thing. Yeah. Fournier's is disgusting. Absolutely disgusting.
It's the smell you'll never forget.
The smell, and you know what grosses me out in my realm of work? Dirty Acrylics.
Yeah, dirty Acrylics are bad.
Dirty Acrylics when they come back out, which I don't know if everybody in the OR, like, it's a national word for Acrylics, neuroheteral we used to call them. Yeah. But it's clingy gauze, and they use it for packing a lot, especially in Fournier's, because they strip them, and like I said, the little testes look like little eyeballs just hanging down.
There's no scrotum over the testicles.
Yeah, they take everything away.
Yeah.
And then they pack it with all these Acrylics, and then when they come back and you have to pull them out, they gross me out. That and a throw pack.
Well, I hate a throw pack.
The way a throw pack smells when it comes out, I want to gag. It's disgusting.
Anything coming out of that mouth is
it's disgusting.
maybe we'll do that for Father's Day.
Yeah, I think that's a great idea.
Okay. Thank you for your email. All right, this one is, I love you guys. Hi, ladies. I recently started listening to your podcast over the past few months, and I can't get enough. I'm already past your Halloween 2021 episodes. I originally found you while searching for medical podcasts, and I'm so glad I did.
I'm glad we're still out there on the podcast realm.
First of all, Nicole, I cannot believe you don't like Hocus Pocus. It's a classic. I'm a huge Halloween fan. My fiance is too, so I definitely have thoughts on that, but I'll save that for another email.
I love Halloween. Probably my favorite holiday.
I know.
Hocus Pocus is not a good Halloween movie.
People love that movie.
They do. They go to the stupid house and film. They dress up like the sisters.
Yeah.
Not my favorite, no.
I've never seen it.
Sorry.
Shocking. There were
Dark Night of the Scarecrow. Good Halloween movie. It's an oldie.
Do you think I've ever watched it?
You don't watch movies, I know.
There were a couple episodes that really stood out to me and made me want to write in. I cannot wait to hear this.
No. Was it the penis episode?
The first was your Christmas episode about miracles. Well, that was a good one.
That was a good one.
I actually have
we need to do an Easter miracle with Pasquina.
with little Pasquina. I actually have a pretty incredible Christmas story of my own. On December 22nd, 2021, my dad came home from the hospital and told me my mom had been having trouble breathing, but thought she'd be discharged later that day. When I called her, she couldn't really explain what was going on. My dad later told me she had an abnormal echocardiogram and a tumor on her heart, a myoma. It was a benign tumor located on her tricuspid valve, but it was extremely dangerous and could have broken off at any time. She wasn't allowed to leave the hospital until it was removed.
What a strange place for a tumor, because
it's right on the valve,
and it's moving constantly. So how does it? That's a tenacious piece of shit.
Yeah. She had surgery on December 23rd, and we spent the entire Christmas holiday with her in the hospital. I'm a dialysis nurse, so I actually knew many of the ICU staff and was allowed to stay overnight, which meant very little sleep. But I was so grateful we could be with her. It was a scary and shocking time for all of us, and she really needed the support. Thankfully, she made a full recovery. My dad even gave her a heart necklace for Christmas, since she truly is the heart of our family.
That's sweet.
Another episode I loved was the one about nurses doing bad things. Very different topic.
So on the other side.
Yeah. And I actually have a wild story about that too. I worked with a nurse named Jim who struggled with alcoholism and would frequently call out when he was on call. One day he acted completely inappropriately. He cut unused dialysis blood lines, restrained a patient who wasn't supposed to be restrained, left the lines attached, and sent the patient back to the floor.
Could you imagine being restrained? I would have to be restrained if you tried to restrain me when I didn't need to be restrained.
The receiving nurse reported it to the PA State Board, and he was ultimately fired. Anyway, I just wanted to say I love what you guys do and appreciate how entertaining and really a podcast is. It's gotten me through a lot of long days. I still have a long ways to go, but I will get there before I know it. Thank you for the entertainment. Olivia. P.S. You can use my name.
Well, Olivia, I'm really glad your mom's okay, because that could have really gone bad.
What a shock. Like, I'm having a little hard time breathing. Oh, you need to have open heart surgery on your tricuspid valve.
Yeah. That would be the kind of tumor I would get.
Random.
Just some random shit on the most busy part of my body.
Oh, thank God she was treated and fine now.
Is this the one I'm supposed to read?
Yeah.
Okay. I'm laughing at that. I'm not going to get past Hocus Pocus, Olivia. It's up there with Wizard of Oz and Sound of Music, which my husband put on again the other night. I think he thinks he's going to change my mind about the Sound of Music. I'm like, I hate this movie, Brian. Why? If you're going to watch this, I'm going to go upstairs. And Vienna's like, it's not that bad. I'm like, it's that bad. I fucking hate this movie. And Brian's like, should we go to the Von Trapp Family Lodge in Vermont? I'm like, no, I will never go to the Von. I will never go.
You should do that for his 60th.
I will sleep in a tent.
You should do that for his 60th. He would love that.
I would rather take him to Salzburg and do the bike tour for
all right, 60th. I'll do that.
All right, then go to Vermont. Oh, goodness, now I'm going to be singing those stupid songs. All right. Hi, Nicole and Laura. Just for the record, I was first.
Yes.
I just wanted to reach out and tell you how much I love the podcast. I love that everybody loves the podcast. I'm a younger listener and pre-nursing student.
Oh,
we're getting young.
Really young.
And I started listening back in January. I began at the very first episode. I'll admit I skipped the COVID episodes. You weren't missing much.
No.
And I've been steadily catching up. I just finished this year's Olympics episode, and it made me realize how far I've come with the show. And you realize how much we've lost energy doing some of these. I've recommended it to all my friends, and they've gotten into it too. Good job.
Thank you.
There's something really special about the way you both talk so honestly and thoughtfully. Honest is true. In a little wine, we get real honest. It's clear how much time and effort goes into producing each episode, and I just wanted to say I appreciate it. I don't have any stories to submit yet, but I hope one day I will. Until then, let me skip to the next one. Until then, I'll keep listening and cheering you on. Thank you for everything you do. P.S. I would love a nursing school and or baby nurse episode. Well, if you listen to our very first episode, which you have, that is our nursing school stories.
Oh, yeah.
It's M is how she signed it, Ms. Zhu. So that if you listen to the very, very first episode, we talk a lot about our nursing student episode when we were in nursing school, but we could cover, because nursing school is so different now than when we started.
Well, yeah, when I went to nursing school, there was paper charts.
Yeah, not me.
We had to sign the orders.
Oh,
when
no,
I worked on the floor,
we had to do soap notes.
You had to sign the orders off, like in the paper chart. The doctor would write the orders, and then you would have to go in and sign under it that you took the orders. Like that's how you literally took orders.
It just and I didn't have to.
It
take
makes
a
me feel
math
like I'm
test
1,000 years
to get
old.
into nursing school. Now they're taking like MTELs or the T's.
The T's.
I don't even know what that is. If I had to take those, I wouldn't be a nurse. I would have been done. They'd been like, "Get out of here, you dumb idiot!
Cannot do this.
You can't even add." It's just so different, and I think some of the attitudes coming out of nursing school is so different too. They're kind of like, we get nurses who are shocked that they have to work weekends and holidays.
Yeah, nights.
You are working in a 24/7 facility.
Field. Yeah.
You know, like you have to cover holidays, weekends, and nights. Like that's how it works.
I think some like nurses on like social media have different jobs where they're nurses, but they're like different, not in a hospital setting. So you're not working 24/7. It is great, but if you're going into a hospital setting,
you're going to work holidays, weekends, and nights.
Yeah.
Yeah, it's interesting.
Yeah.
And I'm at the tail end of the career, so it's going to be interesting when I'm a patient.
Yeah.
But it's still a rewarding career. Sometimes like patients like completely decompensate emotionally on me, and I still don't really know how to handle that. I'm like, oh, hey, are you okay?
You're okay.
Yes, I took the peer support training today. I'm like, she's like, what'd you think? I'm like, it was terrifying. I didn't like it. She's like, why? I'm like, because I don't know what she's gonna say. When she tells me she wants to kill herself, what am I gonna say? Well, how do you feel about that? Like, I don't know if this is for me.
You'll be fine.
Oh yeah, I'll be grand. It'll be grand.
You'll be fine. I do it, and look at me.
Yeah, but nobody's. The thing is, and the theory behind this is great, peer support, but we already do that with each other.
I know.
We have a bad case. We go up to the lounge and we debrief amongst each other. So it's not that I don't disagree with it, because I do, but I think some of the older nurses, me being one of the biggest culprits, almost see it as a sign of weakness to go to like a debrief afterwards, or I have to go home. And it isn't.
Right.
If you have a bad, like you do what you got to do.
Right.
But I just turn to my friends. So as we're going through this training, I'm like, well, I just talked to Laura about it. Or I just talked to this one about it.
Yeah, but not everybody has such a great friend.
Clearly.
Obviously.
I mean, not everybody can have Laura.
They try, but it's too much work for me.
They do, but and not everybody's trauma bonded this way.
No.
So
I think people don't have that though.
I agree.
Like
I
this.
agree.
So I get why they do it. Yes, I would just talk to you, but
right. No, I think it's a good service that people need, because one of the stories of one of the doctors that did it, he had a really bad outcome with a patient, and nobody would talk to him because he was the person who had the bad outcome. So he was like isolated, and he kept trying to reach out to the patient, and they wouldn't let her talk to her. He eventually wrote her a letter, and the two of them came up with this peer support program, which I thought was great.
It must have been like so heavy on him, to walk around like that.
He's so when he talks anyway, but you could tell it was weighing on him. He felt so bad, and he couldn't talk to anybody.
Right.
And so I get why they did it.
Yeah.
Well, we've digressed a lot.
We have
from fetal injuries to peer support.
I know.
Which, if you were to work on natal floor and see this stuff,
you would need a lot of peer support.
Because I don't work there. The kid doesn't have a broken arm. I don't want to deal with it because I can't handle it.
No.
It's the reason I'm not in PD.
Yeah.
Okay, so there you go.
Yeah.
That's
Well, keep
brand fresh new episode with some emails for you.
Yeah, my little Pasquina in your prayers.
Yes.
Yeah.
Little Easter miracle child. She's gonna come out looking just like me.
Well, her name's Pasquina.
Brunette.
So, yeah.
Blonde. I'm blonde hair, brown eyes. Yeah. Gonna act just like me. She's gonna be Italian fire coming out of there. They're not going to know what hit them.
No, they won't. That happens.
Well, on that note, have a lovely, lovely day, and we will see you in 2 weeks.
Bye.
Bye.
Like, subscribe, rate, and review the Scissors and Scrubs podcast on whatever podcast app you listen to us on. Follow us on Twitter, Facebook, and Instagram at Scissors and Scrubs. And email us any of your stories or thoughts to scissorsandscrubs@gmail.com.